summer can be a challenge if you're worried about those ugly spider and varicose veins. Dr. John Chuback of Chuback Vein Center in Ridgewood offers this advice. Dr. John, can you tell me how to have the perfect summer leg now that short season and dresses are really, coming to a head? It's getting really nice out, the weather's beautiful, and everybody wants to show off their legs. But some people, I'm sure, have some imperfections that they want to get fixed.
Stockings seem to be out for this season, and the bare leg look is a tough one to pull off for a lot of people. Therefore, we recommend spider vein treatment, varicose vein treatment, as early as possible because there will be some healing time, a couple of weeks at least, with some minor bruising. Depending on what you have done, it could be anywhere from a week to 4 weeks for relatively minor problems. Patients who have more serious medical problems may need 6 to 8 weeks of healing, but they're back in full activity within 2 to 3 days.
And can you tell us the process of getting varicose veins and spider veins removed? Is that a laser?
It's a combination of modalities. We do use laser as the principal modality in the vein center. Varicose veins are treated with endovenous laser treatments. You can learn more about that on my website. And some of the spider veins are treated with a surface laser, but injection therapy is still very important for spider vein treatment.
And should you start getting the laser removal, or the injectables at a young age as a preventative, or do you wait until the problem is really there?
That's a terrific point. I think that as soon as you start noticing spider veins that bother you, they should be treated. The earlier you begin managing this issue, the better your results will be. We oftentimes see men and women who have put this off for 20, 25 years, and they come in with legs that have really sustained a lot of damage, and then it becomes a lot of work, and frankly, the results won't be quite as good as if you start very early.
And how much pain is associated with each one of these procedures?
Well, as you know, Heather, pain is a subjective thing, but most patients tolerate it extremely well. For spider veins, for example, no anesthetic is necessary, and most patients describe the sensation of the laser as sort of being plucked with a rubber band, having a rubber band snap against your skin. And the injections are done with a tiny butterfly needle, and they just pinch a little bit. It's really not bad. Injectable therapy is still the mainstay for spider veins. That's where we inject tiny amounts of medication inside the vein, which causes the vein to close down, and eventually your body will absorb those veins.
And how many times do you have to come back to maintain this?
Most patients will need maintenance over the years, but once their problem areas have been treated, those areas can be expected to be treated for good. The problem with veins is that people who have the tendency toward developing spider veins and varicose veins will usually develop new veins over the years.
Are most of your patients on the younger spectrum, older? Do you have a mix, men and women?
Yeah, we do have an excellent mix. We have men and women. Everybody wants to look good, obviously. We have patients from their 20s into their 80s, frankly, who come in for treatment. So it is a nice mix of patients.
Thank you very much. It was nice meeting you.
Pleasure's
I'm sure I'll be in visiting.
Thanks.